So I work with women who are struggling with low energy, exhaustion, being tired. I think about even at a point in my life when over 10 years ago, when I first got into functional medicine, I was exhausted all the time. I could easily go to a friend's house, sit down on the couch, and there I am asleep, end of the day, fall asleep, crash. And so exhaustion is a really big thing that's very close to my heart because it really impacts how we show up as mothers, how we show up as wives, how we show up in our careers, how we show up in love and everything, just being able to do hobbies, really having energy is really important to me. So exhaustion, women that come to me, they normally have some type of hormonal imbalance that is creating super heavy periods, something that I had struggled with before, very heavy, painful periods, irregular periods. Sometimes I have women that their periods come and then they disappear for a while. They're not there at all. Or they might just have spotting or brown discharge that comes. So, things that are related to menstrual cycle irregularities, women that are struggling with the symptoms of fibroids or endometriosis, PCOS is a big one. So, really, women that are struggling with a weight loss resistance. So, they have tried lots of things to lose weight and they've been dieting, they've been eating right, they may be working out, but they're not losing the weight that they desire to lose. So dealing with that weight loss resistance is a big one as well. Women going through perimenopause, all the things that go with that, the moodiness, the hot flashes, um, the vaginal dryness, all of those different types of things. So, women that come to work with me are typically struggling with a lot of these hormonal imbalances. And they're also women who are typically high achieving women. They are women that have goals that are usually bigger than themselves. They're out to accomplish big things in life. And that may be with the people in their family, with their children, with their godchildren. It may be in their careers, but they're typically very smart women, and women that they're just up to big things. I use the word high achieving because I don't know a better word to use. But usually professional women that are really wanting to get to the root cause of their issues. So they're looking for more holistic approaches to things.
That's what brought me to you.
Yeah.
Um, Let me ask you, what happens if you haven't worked with someone who, say, has like my condition or the condition of the client that's talking to you?
Okay. So what happens if I haven't worked with someone like you're wondering, okay, I have this condition and you may not have worked with someone with that. What do you do? What happens? So one thing is for sure that I am very connected to various groups where I receive high level clinical training ongoing, and there's lots of resources there. So if I haven't worked with your condition, then I know where to go. And then also, if I haven't worked with your condition and then also I don't feel comfortable and it's outside of my area of expertise, then I'm going to help you find someone who can help you. So I'm not into wasting anyone's time or energy, and I know what I'm really good at, and that's what I like to work with. And if it's too far outside of that, then I'm definitely just going to find someone else that can help you with those types of issues. And we'll get into a little bit about how I um, find out exactly what's going on inside your body too, which is really, really important.
Yeah, I love the fact that you said that I'm going to help you find. If I'm not the person for you, I will help direct you to where you need to be. Because like a lot of the times too, they'll be like, "Oh, okay, I can help you," and they
Mm.
just leave you to kind of figure it out on your own. How are you different from, say, my regular doctor?
So one thing is, first of all, when it comes to traditional medicine, a lot of times, and I talked about this before, just my time that I had available before when I was in private practice. Now I'm virtual, so it's very different. So I meet with people all over the country and even the world, come to see me, and they we do it all virtually. So a lot of things that I do, I'm a big advocate of testing, like test, don't guess. Let's find out exactly what's going on inside of your body. And some people are like, well, how do you get the testing to me? Well, we're able to just get everything shipped directly to your house, and you complete your whatever it is. If we're looking at saliva, if we're looking at hair samples, stool samples, different things, I do a lot more extensive testing. You're able to do that in the privacy and comfort of your own home. If we do need to draw any blood, we typically send someone to your house or find a local lab nearby where you're able to get that blood drawn. So it's super easy to handle things virtually. So I would say that's one thing, is that I'm able to meet with my clients virtually. The other thing is that when it comes to traditional medicine, I have lots of friends and colleagues that practice conventional medicine, and they are good people. Okay. I practice functional medicine, which is a little different. But I would say that most people became a doctor because they truly wanted to help people. But we have a healthcare crisis going on here in the United States and much of the world, because a lot of people are suffering with chronic illnesses, and a lot of it does become lifestyle dependent. What are we doing in our lives? What's going on with our stress levels? What's going on with our nutrition, detoxification, our sleep, all of these things that are really important to people. But unfortunately, there's a few reasons why um, traditional medicine or conventional medicine is not typically able to help. One is a lot of doctors are stuck in an insurance model. And there's a couple things with that. So, insurance is created to basically, the doctor needs to find a diagnosis, diagnose you with something, and then provide you with perhaps a drug or a surgery. Okay. So they're in a model where they're looking to diagnose you with something. And when it comes to heart disease, when it comes to Alzheimer's, when it comes to diabetes, these are things that take time before you even get to a diagnosis. I often rattle off different stats about how long that takes, but oftentimes for a lot of these things, it's 10, 20, 30 years before you're actually receive a diagnosis. But there were things going on leading up to those the check engine light. So I always give this example. So let's say that the check engine light comes on in your car, right?
Mhm.
What are you going to do? You're going to go ahead, take your car to the mechanic, the expert, and that mechanic, you're expecting them to help you figure out what's going on, right? So imagine you take
Right.
your car into the mechanic, and then the mechanic comes out. He's like, okay, your check engine light came on. Okay, it came on last week. All right. So what I want you to do is I want you to take this sticker. Okay. And I want you to put this sticker right over that check engine light, and you won't have to worry about that thing anymore. That would be crazy. That would be crazy. We would never allow a mechanic to give us a sticker and put it over our check engine light, right? But for
No.
some reason, we do allow doctors to do that to us, okay? And it's not always done
Mm.
intentionally, but when we just do things to address the symptoms, that check engine light going off in our body, then that's all we're doing. We're just covering those things up, okay? And a lot of times people come to me and they're like, "Well, my doctor ran my labs and everything came back normal, but you don't feel normal. You don't feel good. Your body, you feel like crap a lot of times. So there's something going on, and that's that check engine light going off, right? And we want to address those issues before you get to this stage of having a disease. Okay. I always say the word disease is like dis-ease. Okay. Your body is no longer at ease. Okay. And when you get to a disease, that's all that is a bunch of symptoms that have been grouped together. And you can now label it as a disease. You can bill insurance for it, and you can give a drug or a surgery for it. Okay. So that's
Mm.
that's one way that it's very different. Also, the insurance model kind of keeps a lot of my colleagues handcuffed, because that's how you get paid. So you have to operate within that model of healthcare, and you've got to see a lot of patients because insurance reimbursements have gone down significantly over the years, and you have to see more patients to continue. Whether it's the hospital or someone's in private practice, you've got to continue to see patients. Also, a lot of
Mm.
times, regular doctors have not received the training that they would need to really be able to get to the root cause of these issues. So, whether someone is a MD, DO, DC, um, a what am I thinking? A pharmacist, all of us have gone back and we have learned functional medicine and studied it extensively for hours post getting our doctoral degrees. Okay. So a lot of times, just the regular doctor has not done that. So they don't have the training on really how to address these issues from the root cause. And they also don't have the programs in place. Which take time. So we've got to spend time with people to really know what's going on in their health and in their life, and there's just not the time for it, and the ability to implement these programs. And again, a lot of times insurance does not cover these things. Insurance, Medicare, who sets the guidelines for all insurance companies, they literally have a quote that says that issues that are preventative, issues that, or not issues, programs, treatment that is preventative, if it's looking to prolong life, all of these things are deemed not medically necessary. So they're things that insurance is not going to pay for. So we're waiting on insurance to really kind of come in and save the day. We're gonna really be waiting a long time. So a lot of the times you had asked me about the women that work with me. They're women that are willing to invest in their health and advocate for themselves and do the things that need to be done to really take care of their 60-year-old self, their 90-year-old self. And I'm saying that most of the women that work with me are between the ages of 35 to 55 ish. But they're thinking about, okay, how am I going to be moving when I'm 60 or 70 or 80? What am I going to be able to do then? And what do I need to do for her?
That is 100% correct because that's how I felt. And so coming to you was a blessing to
Oh.
be able to set me on the path to my 90-year-old self.
Good, good.
So let me ask you then, what exactly is functional medicine and why does it matter?
So, functional medicine is where we're looking at the root cause of your health issues. Okay. So, we're not looking at, oh, you're tired. So go ahead and, oh, maybe you're low on B vitamins or iron. We're not guessing, first of all. But we're looking at the root cause of why these issues are showing up. So, just like that mechanic, we are opening up the hood, we're running diagnostic tests, and we're finding out why is that check engine light going off? Okay. And oftentimes in functional medicine, we're looking at, um, your stress levels. We're looking at how the stress levels are affecting your hormones, and we're able to test those things throughout the day and see what's going on. That information oftentimes comes from your saliva. How many times have you been to your doctor and they've been like, yeah, let me get, let's check your saliva? That's usually not a routine thing to do at all when it comes to your hormones. For me personally, and I can't say this for all functional medicine doctors, but for me, since hormones is my world that I work in, oftentimes, when you have your hormones tested, they're looking at your what's going on in your blood just that day that you came into the office. Maybe they, if you're lucky, they may look at things on day 3 of your cycle, or they may have you come in multiple times, but that's extremely rare. Very, very rare. Normally they're like, yeah, let's check your hormones today. And they check and they see what's going on. But our hormones change throughout the month. And specifically with estrogen goes up during that first half of the month and it comes back down. And then progesterone, it goes up and then it comes back down. Okay. So we need to see, is it going up and down? Are they doing what they're supposed to do? So for me, I test throughout the month and see what's going on. And I actually test that in the urine, so that gives me so much more information about what is going on with your hormones, how they're metabolizing in your body. So, metabolize means like, how's your body using it and how is your body also getting rid of it? Because
Mm.
estrogen itself can actually be toxic if it's not moving down protective pathways. As it's metabolizing in your body. So it's important to be able to look at those types of things. oftentimes people may just take melatonin for sleep. Well, let's see what your melatonin levels look like, and let's really see, is that even the reason why you're not able to sleep? Is there something else going on with different hormones within your body? Is there something going on in your gut? There's various things. We can look at how you're digesting your food, how you're absorbing your food. Food sensitivities is a really popular thing that people like to look at as well. So, and toxins, that's huge as well. And looking at the toxins and what's going on inside of your body, and how heavy is that toxic load on you. I always think about the different stressors that people are dealing with. There's the physical, emotional stress, but then there's chemical stressors on the body. There's toxins. You could have biotoxins, so viruses, bacteria, parasites, fungus, mold that's living inside of you, environmental toxins, things from what we eat, the air we breathe. All of those types of things can be stressors on our body. And then just flat out having deficiencies too, and not having proper nutrient absorption, lacking sleep, oxygen. All of those things are stressors on the body. And what I do is basically think about if you were climbing up a mountain and you've got a book bag on your back. And as you're climbing, someone's coming along and they're putting a little mold in your backpack, big heavy boulder, a stressful work situation. They're coming in and they're putting in a vitamin D deficiency. They are coming in, and I'm saying life, all of those things, you're carrying all
Yeah.
these stressors up this mountain. It becomes harder and harder and harder. And then after a while, your body it spins out and goes into this disease status. And now you're showing up and you have PCOS, or you have endometriosis, or your weight loss resistance. You're going through perimenopause, and it's awful. It's not a smooth transition, and it can be a smooth transition for women, but most people are not living optimally. So we have normalized having bad periods, having hot flashes, being exhausted all the time. And those things are common, but they're not normal. So, as a functional medicine doctor, what I do is I look at the root cause of what's going on and kind of like, let's see what you got in your backpack there. Okay. Let's see what you're carrying around with you in your everyday life.
Then that brings me to, which you touched on just a little bit. What type of personality do you work best with? And what is expected of me, your potential client?
Yeah. So one thing is that we work together. Okay. So this is not a situation where, we're like, okay, go do this, go do that, eat less, move more. We're not, first of all, we're not giving out general things, but we're really looking at your life and we're working together. So for me, I work best with those who are committed to seeing results until the end. So one thing that we talk about jokingly about amongst my colleagues and with some of my clients is like, this is not a drive-through wellness hookup. Okay, so you're not just coming in and you're like, hey doc, can you run some tests on me and give me some supplements to take? And then most people do feel good pretty quickly. Things start to change. But then if I were to work with people just looking for that, because we didn't actually address the underlying issues completely and fix it all the way, they come back. The issues come back, and I don't want you blaming me. But I also want you to be healthy, and I really want you to be able to resolve these issues. So the type of personality that I work best with, they're people that want to see it through to the end, and they really want to address those underlying causes and fix it. And they're typically someone who's positive, they're upbeat, they're hopeful, and they're really willing to put in the hard work.